Hi, my name is Dr. Forrester Dean, and I'm here again with
Venzel.
Nice to see you all again. So today we're going to talk about acceleration into deceleration, and this is part of the COREX system's principles. It's not one of the 5 principles, but it's built in within the principles.
Exactly.
And so the idea here with acceleration into deceleration is we're asking the athlete, or just regular folks really, but we talk mostly about athletes, to employ quickness or suddenness in their movement, right? And so we identified a variety of different moments or situations where quickness and suddenness is either necessary or utilized, right? Used, or where it could actually become part of a therapy, right? So that's kind of like our high point is going to be talking about the therapeutic value. Okay, let's first talk about quickness and suddenness with athletes. So you said something when we were just kind of talking about it this morning. You said something kind of shocking to me. You said it's actually like
Violent.
It's violent.
It's very violent.
He said it's like a violent type of way of using the body. And that, like, I was like, it's kind of like a rush, because it's like, that's pretty cool, but it's also like, wow. Right? So let's talk about, let's just say that violent type of movement is good and okay, right? It exists, right? So let's kind of break that down. So he said that, and then I said, it utilizes the full nervous system. Right? It's a big command, like there isn't any part of the body that gets left behind.
Your whole body has to recruit. With a violent movement, everything has to be stable as well as mobile simultaneously in that movement.
Right. And so let's break that down, because we have a couple of situations we want to talk about. So the first one I thought of was in direction change. So let's say I'm an athlete and I'm running down, right? And I'm going to make a direction change, and it's quick, but I'm kind of planning that, right? It's sort of, within my, like, I got to get down here and I got to cut, right? I know I have to do that. And another example we came up with is like with hurdling. And you said that you're not jumping.
You're lifting. So you have to recruit the body in a different way from the hips. So usually, I want to compare jumping to hurdling really quick. Usually people, when they see hurdles, they think we're jumping, but that's an illusion. That's an optical illusion. We're lifting. So the way we plant when we jump versus lifting is completely different. And how our spine recruits and stabilizes when we lift or we press.
And when we were walking, you said something about the rigidity.
So going back into that, you want to have in your spine, you recruit. So basically, our intervertebral disc, it's kind of like gelatin, like it's a very viscous fluid. And when you want to have stability or any movement that's sudden and quick, it goes from that semi-solid state to a solid state before you make an athletic movement. It has to go to that solid state to recruit stability, which allows us to have mobility.
And that solid state requires that violence. But it's the suddenness of it. It isn't so much that it's like a power lift. Power lift is the opposite of what we're talking about.
That's going to take time. And
the other opposite we talked about is it's not like pull-ups. Right? Or jump. So jump has a lot of elastic preload. So we're not talking about that kinetic build-up of energy in the elastic components of the body, or even within the musculature. We're talking about that just moving forward without the plyo part, although we have to admit that it does involve some bit of explosiveness, not so much with that kinetic buildup, right, of energy. So I brought that up, direction change and hurdles, sort of that's the conscious use of acceleration into deceleration. And then you brought up
About football, which is, say for instance.
So tell them what it is first.
Okay, so it's telegraphing. So telegraphing is when you do something and your opponent can see what you're doing even before you start to do it, because you're giving them cues to feed off of.
So it's like you're making a phone call on your telephone, and you're telling the opponent,
this is what I'm about to do. So go ahead and stop me. So that's basically what you do when you telegraph. It can happen in boxing, telegraphing punches. You can telegraph a route. You can telegraph when you're about to catch the ball. So say for instance, Dr. Dean is a DB, and then I start to look.
Oh, and you're giving away.
So now you know when to make a break on the ball. So you don't even have to look back. You just look at me and you read me.
Right.
That's why if we both were running, like I would use my peripheral vision to see what the ball is at the last moment. And then I would go off and make a cut, blah, 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 do what I need to do for myself.
So the example is you sort of withhold your plans, but then because you're withholding, time's not on your side.
Yeah.
So now
it has to happen suddenly.
That quickness, that suddenness has to come, that blur of movement has to come into play.
Yeah.
And then you brought up the next one, which is
the scramble. As a quarterback, specifically a quarterback, this is where the mental component comes into play, because now he has to survey the field. So now this is mental quickness. So he has to make that split decision to, okay, this pocket's going to break down. Okay, now I need to make a break. And then I have to still keep my eyes up, keep my hips squared so I can line up and hit my receiver.
Right,
so
or have a variety of options. So the idea of the scramble is I have an idea in my head, but if it falls apart, I have to employ my body in a quick way, not just the thinking part, but I have to add the thinking change with the movement change, and then also maybe not telegraph, or also maybe not give away what I'm going to do.
Yeah.
Right? So you wouldn't point to where you're going to throw the ball. No. And then the last one we came up with is sort of these emergency situations. Yeah. And the one I wanted to bring up, for example, is in soccer. So let's say I'm running across the field and I kick, right? But I don't land exactly as I expect, right? So I have to suddenly correct my entire center of gravity, maybe, so that I don't fall, right?
Exactly.
Fall prevention. But that all happens only because I got proprioceptive feedback from that ankle mortise, from my center of gravity changing. And that causes the quickness.
Exactly.
Right? So it's the motor recruitment sort of as your savior, right? Saving grace, so you can continue to play and not get injured.
Yeah.
So the other example I came up with is it's sort of in strategizing, especially like with tennis, is sometimes I have to be ready to accept a forehand or a backhand. Especially returning a serve.
Yeah, that's coming at you at 100 miles per hour.
Yeah, and it's going up, the speed's going up all the time.
Yeah.
So that's a bit of a unplanned, but in that there's so much of the nervous system that gets hit so quickly, and then after that hit, I have to perform.
Yeah.
So it's a bit of sequencing, right? And we have sequencing as one of the 5 principles of the correct system. Okay, so that's sort of the breakdown. And so obviously this is all, we're talking about sports right now, but we're going to hit them with this completely new concept of using acceleration into deceleration.
Exactly. It's
in therapy.
Yeah. And it's very pertinent, especially because most of the population, they have, what we like to refer to them as industrial athletes, because they're athletes in their own right, in their profession, because you have to do a specific task every day when you go to work, especially if it's a manual labor type of job. That requires a lot of conscious movement to either keep you from being injured or making sure you perform your job safely where you don't form a faulty motor pattern.
Right, and then also like reacting to things like your tool bag falling off.
Exactly.
Right?
Exactly.
Get out of the way.
Yeah.
Yeah. So what we want to do is we want to explore this idea of acceleration into deceleration, and the driving force behind why we want to bring this even up is that if it's so prevalent in sports, and we already agree, the exam, the therapy, it all has to match how the athlete moves on the court or in the field or in the pool or wherever, on the cliff, wherever they are, track, right? So the idea is, if that sport requires quickness and requires acceleration to deceleration, for example, right? Thank you, Dr. Rucker. I just, my elbow kind of hurts today, and I was kind of hoping you put some ice on it and maybe do a little sports massage. I'm trying to get to the top of my tennis game, like competitively. So would that help me?
You would have some short-term relief, but will that help you be the best tennis player you could be? No, because you're not doing the task that's going to get you to becoming the best tennis player.
So I can't play tennis today or tomorrow or maybe till next week, maybe?
No, you can play tennis today. That's the job.
How?
So that's a part of the therapy.
So
you need to be able to get that. Yeah.
It's like this acceleration type therapy. Can we try that?
Of course.
All right. So we're trying to make a funny point, and the funny point is that ice, heat, sports massage, whatever you're going to do, and the patient's sitting down or laying down or whatever, it doesn't match that quickness I need in tennis. Doesn't match it. So the therapy in a like best case scenario, which we're just trying to add another layer of best case scenario in the therapy world.
Yeah.
What about acceleration, deceleration? Let's try that. Okay. Yeah. So this is a couple key points why we like this. Okay. Now my complaint is at the elbow, let's say tennis elbow. So we already know I'm playing with an outstretched arm, which is a problem. I'm not playing with my elbow close. But besides that point, my elbow is part of a system that's part of a sling.
Exactly.
So when we just say, hey, what about acceleration, deceleration? We know we're automatically including our therapy point within the full sling.
Myofascial sling, yes.
If we're using acceleration, deceleration, the whole sling is going to be included, and that therapy point is just a piece of real estate within the full sling, right? Exactly. So benefit number one. Also, we aren't just going to treat the elbow, it's going to also treat the elbow's relationship to the shoulder and even to the spine and the pelvis through that sling. Okay, so just saying, no external loads required. No dumbbells, no rubber bands, no stuff. Right now, why do I care about that? Because there are no dumbbells on my tennis court. I don't play with the dumbbell, so why am I including dumbbells in my therapy?
Exactly. It makes 100% sense.
And then what else?
So also to deal with that, you have to be able to program that with the sport specificity, what we were talking about before with the treatment plan. Like you were talking about getting you back to playing that same day. The therapy should be incorporated in that. So movements that are similar, if not directly correlated to the sport.
So what we're saying very bravely here is, yes, I'm a patient with a faulty movement pattern or whatever, and pain.
Yeah.
But there's no good reason why I can't use acceleration, deceleration therapy.
Exactly.
I'm not talking about this, we have to be clear. I'm not in that acute phase.
Yes.
Right? This didn't just happen today, right? So it's been kind of accumulating over time. So we're not talking about a new injury. We're not talking about a fall. We're not talking about any acute trauma. We're not talking about any of that. That's not appropriate. This type of therapy isn't appropriate for that.
Exactly.
Okay, so what we're saying is that if we use a dumbbell, we're stuck with the gravity loading. But if we remove the dumbbell and we remove the elastic bands and all those tools, and we are just using the sling, now we don't have to rely on gravity-fed therapy only.
Yeah.
We can move in any plane of motion we want.
Angular.
Right?
That's going to be, yeah.
And so that opens up the door for every sport there is, because every sport has its unique sort of planes of motion.
Yeah.
Okay, so we also talked about this a little bit, the preventative point. You brought this up, the preventative point. And so tell me again how you explained that to me today.
Okay, so the reason why I brought up the preventative measure is because of signaling. Because the priority is signaling. The brain is going to pay attention to the one that requires the most attention, which is the signal that's at a higher frequency. And change in speed, that suddenness, that quickness, is a higher signal than what? Pain. So because it you recruit more motor neurons with the change of speed, the brain pays attention to that more than it does the pain. So like we were talking about before, being able to move through that pain, initially you might feel a little discomfort for the first few to 3 to 4 sets, but at the 7th, 8th, 9th, or even 15th rep, now you don't have pain anymore, because now what we talked about before, that pain has become, and that motor pattern that was leading to pain is now becoming novel. So what we talked about, how it leads to unlearning that faulty motor pattern and learning the correct motor pattern.
Right.
Yeah.
And then by comparison, classical therapeutic movements are slow and controlled, right? So the firing is at some subset of maximal nervous system, especially if you're just firing a joint.
Exactly.
Right? Instead of the whole body. So if we're firing the whole sling or even the whole body connected to that therapeutic movement, then you're really talking about the highest possible priority, because so many motor units are being used that the pain signal just fades. It just disappears, right? So we've got a lot of content on that priority of signaling. We've talked about it before. His description was perfect. So we're just going to kind of leave it at that. And if you want to learn more, just dig around in our stuff and you'll see it. Okay, so I want to give a couple of examples of how this can work. Now, just simply, so let's kind of face each other. Actually, I want you to turn a little bit. So Venzel's going to come into core neutral position. And so what I'm going to do is I'm going to create a target, right? And I'm not going to tell you where it is. And you're going to have to respond very quickly to where it is. Now, we didn't practice this, and I have no idea how this is going to go, right? So the idea is if I put my hand up, he has to match it and leave an inch, right? So if I go here, he has to reach more. If I reach there, he's got it right. So what he's doing is he's watching, he's paying attention, he's looking at my body language, right? And then he's giving me a reaction without knowing where I'm going to be or what plane of motion I'm going to be in, right? So he has to map as quickly as he can. That's what we're talking about. That's a super simple example of acceleration, and specifically into deceleration, because I'm asking you to stop, but he's stopping with no stimulus, right? Because we're not touching hands, stopping with no stimulus, okay? Now, even if you had a shoulder issue, elbow issue, wrist issue, within that whole chain. Now, what if I started you standing and you go into core neutral and you've got to get there, okay? So let's see it. Not just standing, right? That's full reaction time. So now he's adding, he has to land in core neutral at the same time, right? So every motor pattern in his body is awake, going from relaxed, you're turning on your whole nervous system. It's a super, super basic drill. Let's say I do that a little bit, you can already feel like you're warming up a little, right? Yeah. So your eyes are turned on. You're even listening to the room.
The cues.
Right. Your breath is changing a little bit. Right. And that's very different than if I just, give me a little resistance. Right. It's just not the same thing.
Yeah.
Okay. So what we're looking for is acceleration into deceleration, and treating the acceleration into deceleration as novelty in therapy. So yes, you can put a dumbbell, you want to strength train that way, that's fine. But I'm going to say, if you want to take it to the next level and you want to accelerate the patient's healing, right, making sure they're in the right phase of healing for it, why not add? Why not?
Yeah.
Right? You don't need to buy anything. Just see what happens. You don't, not just with the hands, you could do this with anything.
Yeah.
Okay.
And also to just piggyback off of that point right there, when you were talking about that literally made me think of specifically that speed change, and how we were talking about that novelty, or before when I mentioned the novelty of the faulty motor pattern, now the novelty of the corrective motor pattern, you're doing that, and now you're taking that novelty and making it known and making the faulty motor pattern novel. So now you see how
reverse roles.
Yeah, and that basically allows you to get back into that proper mechanics of your sport specifically. Yeah.
And I'm going to be brave and say, when the faulty movement pattern suddenly becomes novel, it takes the injury with it. Bye. See you later. Hey, grab that ball.
Got you.
All right. So I came up with this. I was kind of hanging out with Maria.
Okay.
And why don't you hold that? And so I said to her, okay, so I want you to chop into this ball. Same thing. Let's say you have from basketball or whatever, say an elbow injury.
Gotcha.
Okay. I want you to chop into that ball pretty hard.
Yes.
That's, Maria, I want you to chop into that harder. Okay, that's clearly harder. Now, how is that? That's acceleration into deceleration, right? Now, I want you to hit it as hard as you can, but I don't want you to transfer weight into the ball. But I still want you to hit it as hard as you can.
Yeah.
Right? Now that's almost imperceptible, but I mean, do I look like I'm working hard?
Yes.
Right?
Yeah.
Okay, now we just reversed roles, and now it's deceleration into acceleration.
Yeah.
So now you have two options, right? Now, I'm using my elbow through its functional range of motion. We talked about this, about 120 degrees.
Exactly.
Right? If I have dumbbells and I'm going like this, I'm going from that 180 to like 30-ish, right?
Yeah.
But the functional is somewhere like 120-ish, maybe 90-ish. It's probably open for debate, right? What I'm saying is I'm adding a whole new layer of novelty.
Yeah.
And all of this novelty, like Venzel says, takes that pain signal and pushes it down to the bottom of the priority list. Right? So that's also really simple, and this could be done a bunch of different ways. So let's try, we have one more example. So let's get out of the elbow here.
Okay.
Go ahead and put that on.
Gotcha.
So I like the contact pads, use these all the time. Now let's say I have rotator cuff.
Okay.
Right? And so, the classic thing is, I'm going to
press against the wall.
Try to get right?
Yeah.
But if I'm moving slowly, aren't I kind of
you're focusing
paying attention to
that pain signal?
Right?
Yeah.
So what would happen if we sped that up and used our acceleration into deceleration? Now, I've done this a lot. I mean, we've done some of this together, but I've done this a lot and very creatively. And we're not going to show this, but I actually have used a baseball bat even, okay? And it's worked really well. And actually, did it on me, and I was like, my leg just felt amazing, right? So we're going to talk about external rotation. So you're just going to hold up that contact pad, right? So I'm going to come in. So like he said, this is a peripheral drill. I'm not going to look at it. I'm going to create complete novelty because I don't really know exactly where it is. So I have to figure out where that is.
Yeah, search for it, yeah. Not
just, hey, can you do 10 of these for me?
Exactly.
Right? So each one, it's going to change a little. So I'm going to come in. I'm going to give it that external range of motion, right? That quickness, that suddenness. See how he's changing that angle? And then you say, oh, but you have a shoulder cuff injury. That would really hurt. It doesn't really hurt.
Nope.
Remember we started this, that violent vibration, just like he said, at the spine, at the disc, that violent vibration does the same thing at the shoulder capsule.
Yeah.
The capsule responds with that mobility into stability, back to mobility through that range of motion. Now, this drill is not gravity fed, and every repetition was different.
Yep.
And I had to figure out how to get there.
Exactly.
Right? So the main message here is to add novelty potentially in a therapy setting.
Yes.
Using this concept of acceleration into deceleration with a bonus of deceleration back into acceleration.
Yeah.
And making sure that there's a lot of open chain and compound myofascial slings with the most nervous system possible being fired, even if it's just an elbow complaint.
Exactly. And then how you check your work with all that is because what we do, it should feel powerful. You should feel stable and controlled. That's how you check your homework. That's how you know what you're doing makes sense, because it would allow you to have stability through that mobility that you're displaying. That's a big component to why the therapy works.
So you're saying just have the athlete or your patient just go through their usual movements and be like, oh yeah, man. How is that possible? Yeah. Okay. Hopefully you enjoyed that. Stick around. We have a lot more coming down for 2022.
Yeah.
Thanks so much, Dr. Dean.
Venzel.
See you soon.